Welcome to a new episode of Science in Context. I'm Sabine, and today Professor Azra Ghani joins me to speak about her new role as the director of the MRC Centre for Global Infectious Disease Analysis and the funding that she secured for the next 3 years. Azra, coming out of the pandemic, what are the research priorities for the MRC Centre going forward?
Well, clearly COVID has changed the way that the world views infectious disease threats, and there is therefore a much greater emphasis on preparing for future threats. The work of the Centre will very much continue in this vein, both in terms of our ongoing support for outbreaks and local epidemics, as well as supporting investments to prevent future pandemics. But we are also aware that we need to mitigate broader future threats, such as those driven by climate change and the changing environment. Part of this preparation also means doubling down on existing endemic infections, ending the burden associated with diseases such as HIV, TB, malaria, and the neglected tropical diseases.
The MRC Centre has established a Translational Hub. Can you tell us a bit more?
Our Centre's always had a strong ethos of collaborative applied research, working closely with national and global health agencies. We're therefore establishing a new translational modelling hub to bring together the work that is done across the different academic groups into a single entity. This will include a new grouping of technical analysts whose roles are to work closely with research groups to support the translation of the work into outputs that can support our partners' needs. These will include existing partnerships with organisations such as the World Health Organization, the Global Fund and Gavi, as well as new partnerships, for example, with the Coalition for Epidemic Preparedness.
And what is your vision for the MRC Centre?
Well, one of our priorities over the next 3 years is to support the development of a global community of mathematical modelling teams. Building on the wider investments that are being made in this sphere, my hope is that in the next 3 years we can see truly equitable partnerships across the globe and that we are united in our efforts to eliminate the burden of infectious diseases.
Thank you so much for your time, Azra.
Thank you.